Okay, once again with Male Repro, just a quick reminder. We had our epididymis with the ductus deferens there. So ductus deferens. Epididymis was here with a head, a body, and the tail down there. Testicle is over here. And then we had a testicular artery coming through there. And then the testicular vein had this pampiniform plexus here and finally ran up like so. And then when those testicular structures and the ductus deferens are running together, this is where we get our spermatic cord. And you saw this forming inside right at the vaginal ring during dissection. And most of these horses have been castrated, or we're finding a lot that were cryptorchids, and the testicle was trapped within the inguinal canal. I've seen 2 bilaterals and 1 unilateral so far. So I'll put one of these normal ones out in display case so you can see those things. Remember how this sat. So make sure that you see the ductus deferens inside the pelvic cavity curving caudally towards the urinary bladder and the area of the prostate, and then your testicular vessels heading up towards the aorta and caudal vena cava in a cranial direction. I think most of you have seen that. Okay, so nothing new there. The new stuff, we'll start with this. Now, what we will see in the ruminants and the equine is the urethra, as it's running through the penis, it's got a free end out here that the dog didn't have. So looking at this on cross section, you can see the urethra here at 8, and the end of this right here where there is space around it, that is the urethral process. Okay, so it's projecting out from the penis, so the urethral process is there, and you can barely see it poking out the end of this fossa right there. So urethral process sitting in a fossa in the glands. So that will be a new structure in large animal, this urethral process. This is a picture out of your dissection guide. There is a fossa glandis, is this fossa sitting around that urethra, around the urethral process, allowing that thing to be a process, not totally embedded. And then we have a urethral sinus, is just a dorsal caudal extension of that fossa glandis down here. So urethral sinus, this dorsal caudal extension, that's important. As horses are walking around, those front hooves are kicking up dirt and junk up against the belly of this horse. Horses will lay down in the dirt and so forth. So if you get animals in a really dirty area, some of these horses, walk around on sawdust, things like that, it gets packed up in here. And there are a lot of sebaceous glands, secreting sebaceous material. That dirt and sawdust and dust and gunk gets junked up in here, and it just causes this nasty, greasy substance that you've been seeing in the prepuce of your horse called smegma. You have to go in and clean it out every once in a while just to keep your horse, nice and clean. But that stuff will get up in this fossa glandis right here, and it will start packing up in this urethral sinus, and it packs up there and starts forming a little nodule, and they call it a penile bean. And what happens is, as it gets in there, when your horse is urinating, you'll see a stream of urine coming out, but as that bean gets in there and starts getting larger and larger and larger, it starts pushing down from the dorsal aspect onto this urethral process, and it's like taking a water hose and squirting a stream of water and then putting your finger over the end of it, and it kind of sprays. Owners will notice when their horse urinates, it's going to come out in a spray rather than a stream, and you've got a penile bean up there that's impinging on that urethral process and blocking off the lumen through it. And she got to go in there and just digitally, manually remove that thing, and everything will be back to normal. So there are some new structures right there that the dog did not have. Another thing that we see here, this is the ventral body wall of the animal, and here's a prepuce right here, and sitting right down over here, this would circle around this direction and back into the book, surrounding the penis right there. There's an extra fold of skin in here right there, and this is called the preputial fold. It's labeled, identified as number 4. So what happens is this penis retracts back in. It's relatively longer in the horse than it was in the dog, so there's going to be more skin to cover it when it's exposed outside the prepuce. So when it comes in, it starts telescoping in, and we have this extra fold of skin up in here called this preputial fold. So you've got these things cut on your horse in cross section. Some are back like this. Those of you that it was extended, it'll look a little different, but make sure you see one like this. So you have a preputial orifice at the front of the prepuce here, labeled at number 1. And at number 2, remember this is a complete circle there. We're just seeing this on a cross section. This is called the preputial ring, is the free end of this preputial fold. And we point that out because it's a very thickened structure, and when the horse's penis protrudes, that ring is sitting right here. That is this ring right there is the front end of this dark structure right there, sitting right there. And so you get this swelling on the penis that is a normal structure. So that preputial fold is actually from here to right here, and then this is the inside of the prepuce there. This is that preputial fold, and it's opened out. So when that penis retracts back in, this will close up like so. Now it's out like this. So it will fold in like so when the penis comes back into the prepuce. So this will be a normal structure, and you'll see this large swelling on your animal. Now, one thing I want to point out here with the blood supply to the penis of the horse, depending on what author you look at, there is debate on where some of these arteries come off, and I am going to stick with the Germans because they are always extremely accurate. When we're up here in the pelvic cavity, F they have labeled as your internal pudendal artery. This is the picture out of your dissection guide. You can see the green color over here. Just like in the dog, this is going to terminate into an artery of the penis. In the dog, it gave off a dorsal artery, an artery of the bulb of the penis, and a deep artery of the penis. Those 3 vessels will come off here just like they did in the dog. Okay? Now, this penis is much longer, relatively speaking, on the horse than it was in the dog. So that dorsal artery is coming down a lot farther, and there's a lot more erectile tissue that needs blood. So what happens is the dorsal artery, if you look closely, you can see it come off back here around that pubic symphysis, comes on down, and all the way down through here, down towards the glands. Now we have 2 additional arteries that are going to feed into this dorsal artery of the penis in the horse that the dog did not have. Our external pudendal artery comes out here, and there is a cranial artery of the penis right there that feeds into the dorsal artery. And if you look at D, we have an obturator artery coming through the obturator foramen. And at E, there is a middle artery of the penis coming off right there into that dorsal artery. Okay, here's the point of contention right here. They have E prime, they're calling the deep artery of the penis. There is a deep artery that exists up here. There's a big one here, and there's several all the way down through here. So this dorsal artery is doing more than just the glands like it did in the dog, because the horse doesn't have a whole lot of glands, relatively speaking, to the length of this as the dog did. If this were a dog penis, its glands would have been from about here to here. Okay? So there are several branches coming off down here, and I do not doubt that there is a very large branch here that's probably bigger than the one up here and bigger than these here that they're calling the deep artery, because these are going into the corpus cavernosum. But if we are going to keep things consistent, your deep artery is actually this one up here that comes off your artery of the penis that came off along with your dorsal artery and your artery of the bulb of the penis. So it's actually not drawn in this picture, but you draw another one in here, and these are just additional vessels coming off that dorsal artery of the penis. So we're going to keep this simple. The same 3 back here. We're going to have a middle artery into the dorsal, and we're going to have a cranial artery into the dorsal right down here. You do not have to find any of those arteries to the penis. I want you to see the internal pudendal that most of you have already seen in the pelvic cavity. I want you to see the obturator running with the obturator nerve. You'll see that. And I want you to find your external pudendal artery that gave off your cranial artery of the penis. So I want you to find those three vessels here, A, D, and F, that are giving rise to those arteries of the penis. And that's how we will do that. Okay, looking at other species, this is the bull right here. You can see the urethral process in this location here, ventral to the glands. So this one is not surrounded by the glands like it was in the horse. This one is exposed ventrally and sits beneath the glands. But it will stop before it gets to the end of the glans penis there. So there is the end of the bull penis. And if you look here, this is from the ram, ovine, and here's our caprine, the billy goat right there. Their urethral process, again, on the ventral side of the glands, but this will extend beyond the free end of the penis, and you get this urethral process that is extremely long. So doesn't do anything extra to the animal, offers them, no other benefits, anything like that. It's just there. It's just the way it's designed, and we'll see this in some of our male goats in our last couple dissection labs. One thing I want to point out in the ruminant and the pig, they have a fibroelastic penis. It's not, they don't rely as much on the hydraulic pressure of the blood being pumped into the penis to gain the erection. They already have a penis that is somewhat firm just due to the tissue that it's composed of. There is some blood that will be pumped into it, but the rigidity is there 365 days a year. So what happens is it's not going to shrink up like it does in the horse. This will fold up into this little sigmoid flexure right here. So the retractor penis muscle will pull back on this, and that penis will fold back up into the preputial area, actually back behind it, up in the subkey region here, and folds in this direction. So in the bull, in the ram, in the billy goat, and the pig, we will get this sigmoid flexure. So there's not a reduction in size like you get with a horse, and in the dog as well. We just fold it up in these animals. Now in the pig, this is the free end of the penis in the pig. It's got a little corkscrew-like shape to it right here, and this will be evident why this is needed when we look at the cervix of the sow in the female repro section. One thing that I want to point out is you can see it here within the prepuce. It's pulled back into the preputial area, and we have a diverticulum called the preputial diverticulum dorsal to this channel through the prepuce, and that's where the pigs will save up that boar odor. So just the smell they're giving off, the pheromone type stuff, marking territories, things like that. This is where boar odor comes from, that real nasty smell with intact male pigs. So you will see a diverticulum up there. So there is the boar penis. Okay, our male accessory sex glands. We saw the prostate in the dog. We'll see that in these guys here, most of them, and we will add some others in with it. So we're going to have, in these large animals, and at least some of them, we'll have a prostate. We will have a disseminate prostate. So this will be a gland that you can actually find. This will be prostatic tissue, the same type of glands you find here, but it's not sitting in a nice identifiable gland. It will be embedded in the wall of the urethra. So that's a disseminate prostate there. A bulbourethral gland. An ampulla. And And then we have seminal vesicle and vesicular gland. Okay, so these male accessory sex glands, they are forming the bulk of that seminal fluid. It's there for helping those spermatozoa get to where they need to be going. It's there to buffer the female reproductive tract to protect those spermatozoa when they enter the female tract. And it's also there for nutrition of the spermatozoa as they're taking this journey. So these are the different type of sex glands you will find in our large animal. And we're going to make another column over towards the right. And I will put an E for equine, bovine, porcine, and then ovine and caprine for sheep and goat. So an identifiable prostate that you can see, we will have it in the equine, so I'm going to put a plus there. We will have it in the bovine. We will have it in the pig. And we're not going to see that in the small ruminant. So the prostate we will find right there, caudal to the bladder, right there at the neck of that urinary bladder, just like we saw it in the dog. The disseminate prostate, I mentioned this is embedded within the wall of the urethra, and that will be just caudal to the urinary bladder, so it's in the same place the prostate gland should be. It's just embedded in the wall underneath that urethralis muscle, so we will not see this glandular tissue, and it's obviously, there's not as much of that as there will be of this, and that's why it does not show. So the disseminate prostate, horse does not have that. The bovine and the pig have that in addition to the prostate gland. And then here comes our small ruminant. This is their type of prostatic tissue there. So prostate and disseminate prostate, the bull and the boar have both. Okay, the bulbourethral gland, this is a gland that you will see in the animal when the urethra is in the pelvic cavity and it swings around the ischiatic arch and comes down into the penis out here. That bulbourethral gland will sit right there on the dorsolateral aspect of that urethra as it's coming out of the pelvic cavity and entering the penis. The penis will be back here like this, coming off the ischiatic tuberosity. So bulbourethral gland will sit right there. Okay, and all of these will have the bulbourethral gland. The ampulla is just the thickened portion of the ductus deferens. It's the terminal end of it right before it enters the urinary tract. So opposite the testicle. So it's a thickened terminal portion of the ductus deferens. And the ampulla is found in the equine, the bovine, it's absent in the pig, and then our small ruminants will have this. Okay, the seminal vesicle. The seminal vesicle and vesicular gland, they've got the same type of glandular tissue. It's identical, but the sex gland has a different architecture to it when you see it in the animal. So the vesicular gland, this will be located, or the seminal vesicle, these will be located dorsolateral to the neck of the urinary bladder. So it's right there near that prostate gland. The seminal vesicle, vesicular gland. Seminal vesicle is a hollow structure like so. The vesicular gland will be kind of a knobby, segmented type looking solid structure. So this will be firm. This will feel almost like a deflated urinary bladder. So it's the same type of tissue, just a different architecture. So the seminal vesicle, we will have this in the horse, in none of the other species. So equine has that. The vesicular gland is the shape it takes in those other four species right there. Now, your dissection guide calls it a vesicular gland in the horse. If you want to call it that, that's fine, but the seminal vesicle is the correct terminology for it. So this is what I will use if I ask the question. If I have it tagged in the horse, you can answer either one of these. So when you take a look at these things, the urinary bladder will sit like so, and your prostate is going to be in this region here. It's going to look different in the dog. I'm going to kind of draw it like that. The seminal vesicles will be up in front of that, or vesicular glands. And then the ampulla will be the thickened end of your ductus deferens, will come in right there. And then the bulbourethral gland will be the pair of them back there. All these glands are paired. So one of the easiest things to do is to follow your ductus deferens back, find that thickening, the ampulla. One back from that's your vesicular gland or seminal vesicle. One back from that's a prostate. And of course the bulbourethral is back by itself, not to be confused with any of the others. So this is the setup in which you will find them in your specimens. So when you take a look at this one here, this is the equine. You can see the ampulla here at 4 coming in. Here's a seminal vesicle right here. Here's the prostate, very firm, and you can see the little bumpiness on this picture right there. You can actually feel that. And here's the bulbourethral gland at the back. Most of the times I see these, they're not quite that long. They're kind of rounded about like this. That's a little long right there. It will have muscle over it, and if you cut it, you'll see the gland down inside it. So I want you to go ahead and cut it, and do see that in there so you don't think it's some other muscle sitting back here doing something else. So there they are in the order that I just drew them in that example picture a second ago. Here is the bovine. Ampulla again coming in right here at number 4. Here's that kind of knobby, solid vesicular gland right here instead of a seminal vesicle, caudal to the ampulla. Behind that, they almost have no prostate. They're just going to be a slight little rise right there as a prostate and nothing more. And they have small little bulbourethral glands back here. So again, all those organs in the same order. Here we have the male pig accessory sex glands. No ampulla. You've got your vesicular glands here that look markedly different than they did in the bovine. There's a little bit of prostate gland buried down here. And then we have these enormous bulbourethral glands. They would normally sit back here in the other species, but this is so large it extends all the way up here back to the area of the prostate and the vesicular glands. So very, very large bulbourethral glands in the pig. And then finally, in the small ruminant, we have our ampulla here, our seminal vesicles right here, and they looks like a little bundle of cauliflower. That's what we'll actually see when we get to lab. Little bulbourethral glands back here, and we will not see any prostate gland because they only have the disseminate prostate, so nothing to see there. One last thing I wanted to point out, I'll just pull up the horse picture here. It's where I want you to look for it. If you remember the muscles of the penis, we have our bulb of the penis is up in here, the erectile tissue, and bulbospongiosus muscle was a transversely oriented fibers across this. This will extend much farther down the penis than it did in the dog. You will see that. Here's our retractor penis muscle right there. And then here is our ischiocavernosus muscle coming in off your ischiatic tuberosities on each side. So find those structures in the horse, and I will have some displayed on other species in those cabinets as well.